Hi there. Welcome to the website DUIonlineeducation.com, at least the YouTube portion of it. My name's Paul. It's my site, it's my program, so I guess it's my video. The purpose of this particular video is to kind of give you an introduction as to what you'll find, both with the YouTube videos and also with my site in general. What you're going to see is the culmination over 20 years of work in this field, dealing with folks who have been stopped for DUIs, drinking driving charges, other legal issues that involve alcohol or drug use possession charges, whatever they may be. And then the resulting work that I've done dealing with the education and the counseling that these folks are often court mandated to do. Now, what I found over the years is that while on the one hand there can be some real evidence to suggest that at least some of these folks do indeed have a bigger alcohol or drug problem and therefore could really benefit from some counseling or education, it's not something that I can just magically point to somebody in the room and say, yes, you need it, and this other person does not, and so on and so on and so on. Ultimately, the best good is done for the most people when I just try to present reality and try to present truth, and do that with the hope that, at least for most people, that they will do what they need to do to get the most benefit out of it for their own benefit as well as the benefit of everybody around them. So, what that means is I try not to be particularly judgmental, while at the same time it doesn't mean that you just kind of let a person's attitude go unchallenged. There's a lot of thinking out there that should probably at least be questioned, if not challenged outright, and certainly when it comes to issues revolving alcohol and drug use and alcohol and drug abuse, we certainly live in a country where there have been a lot of things that need to be challenged on whether we're dealing with legalization issues, prohibition issues. There are a lot of people all across the ideological spectrum who probably need to look at some of those attitudes a little more closely. So I try to, as impartially as possible, just kind of go over things in the healthiest, most honest, most direct approach possible. Anybody who goes through my program will go through the section, a video portion, where we deal with the reasons why they ended up being here. Most people are here for a court mandate, and it may involve a legal charge that they acknowledge, that they've admitted to. Sometimes, of course, it's with the charge that the person is denying outright, that they're denying completely. I think probably the most common reaction I've gotten over the years is the person who acknowledges it partially. Yeah, I was stopped for drinking and driving, but I felt fine. Or, yeah, I was pulled over by the side of the road, but I pulled myself over deliberately so that I could go ahead and take a nap and be okay later. Sometimes some of that thinking just requires a little exploration. And for some of the folks, especially those who are going to be doing the larger groups, issues related to use disorders, what used to be called abuse or dependence criteria, is certainly something we're going to be going over a little bit. For people who have longer groups, longer legal expectations, we're going to deal a lot with not just alcohol and drug pharmacology, but just the nature of drug dosaging, is that a word? Drug dosages been doing this for 20 years, so I have a hard time pronouncing things. Drug potency, drug purity, issues that have a very real effect on what a drug does inside of the body and inside of the mind. Deal a little bit with legal issues, and then really talk more about how the person would know if it was a bigger alcohol or drug problem. Then we're also going to need to spend some time talking about just healthy recovery planning. What is the person doing in the here and now to avoid misuse, to avoid problematic use of alcohol or other drugs? Again, with the underlying question, how would the person know if even their most basic thought patterns are starting to slip back into old using, drinking, old bad habits? There's a lot of wisdom, I think, that people in early recovery, some of the early founders of AA, had back in the 1930s that still applies, I really think, to a lot of people who are trying to deal with alcohol and substance use, and that's how the thinking precedes the drinking. That was an old AA phrase, and it's still being used these days. There's a lot of research now when you're looking at relapse and relapse prevention about how much of the relapse process involves simple, subtle, but powerful, and unfortunately sometimes deadly shifts in the thought process long before the person actually picks up anything to drink or use. And then we'll talk a little bit about when a person knows that they're ready to be done. And we'll probably spend a little time talking too about how, while there's certainly people who do this involving conventional recovery groups, 12-step groups, AA, and so on, while that's certainly a commonly accepted way of getting it done, it may not always be the way that will work for some people, and there actually might be some other options, and we can talk about that too. Anyway, with that said and done, hope you enjoy the groups. Always feel free to contact me at DUIonlineeducation@gmail.com, or if you really want to, I suppose, you could call me or text me at 815-915-4055, especially if you're a paying client. Anyway, be safe, be well, and as my father used to say, perhaps we'll be seeing ourselves. Take care, everybody.